Hello and welcome. Caring for our elderly loved ones as they navigate the later stages of life is a journey filled with deep love, but often also profound uncertainty. We watch them change, perhaps slow down, and sometimes we notice shifts, subtle or more pronounced, and wonder, what do these changes really mean for their health? Are they just part of normal aging, or could they signify something more serious? Discussing the end of life is inherently difficult, and predicting the future with certainty is impossible. However, healthcare professionals who dedicate their careers to caring for older adults, geriatricians, palliative care specialists, hospice nurses, often observe certain patterns of change. These changes can indicate that an individual is experiencing a significant decline in their overall health and resilience, sometimes signaling that the final chapter of life may be drawing closer, perhaps over the course of the following year or so. The intention here is not to engage in morbid prediction, but to foster informed, compassionate awareness. Understanding these potential indicators isn't about counting down days. It's about better understanding needs and how best to offer support. Today, guided by observations commonly noted within geriatric and palliative care fields, we will gently and respectfully discuss 7 potential warning signs or significant changes that may sometimes appear in elderly individuals during what often proves to be the last year or phase of their life. Recognizing these potential shifts is not about losing hope. It's about gaining understanding. This awareness can be incredibly valuable. It can help families and caregivers provide more attuned, empathetic, and effective support. It can prompt important, though perhaps difficult, conversations about care preferences and goals. Ultimately, it can help ensure that an individual's remaining time is lived with as much dignity, comfort, and quality as possible. But I must stress again, with utmost importance, these signs are not definitive predictors of death within a year or any specific time frame. Many other factors are at play, and medical consultation is always essential. This is undoubtedly a sensitive subject. We approach it today with respect, aiming for understanding that can lead to better, more compassionate care. Please stay with us as we explore these potential indicators. Let's begin by exploring the first commonly observed change related to energy levels. Potential sign #1. A significant increase in fatigue, weakness, and reduced activity. The first potential indicator is a significant and persistent increase in fatigue, profound weakness, and an overall reduction in daily activity. This goes beyond the occasional tiredness common with aging. It refers to a marked, noticeable decline in overall energy levels that persists despite adequate rest. The individual might spend significantly more time sleeping or resting in bed or a chair than they used to. They may show markedly less interest or physical capacity to engage in activities they previously enjoyed, perhaps stopping gardening, skipping social club meetings, or no longer taking their usual walks. Even basic self-care activities like bathing or dressing might become exhausting. This profound fatigue and weakness often reflect a general physiological decline, diminished organ function, reduced cardiopulmonary reserves, or the toll of progressing chronic illnesses. The body simply has less energy available to fuel daily life. Imagine Mrs. Roberts, an 85-year-old who, up until 6 months ago, enjoyed short daily walks and attending her weekly card game. Now, her family observes she rarely leaves her favorite armchair, naps for several hours each afternoon, declines invitations stating she's just too worn out, and needs help with simple household tasks she previously managed. This significant shift from her established baseline, this pervasive lack of energy, warrants gentle attention and assessment. Think of it like a rechargeable battery nearing the very end of its lifespan. It takes much longer to charge, holds less energy overall, and depletes very quickly with minimal use. It needs to be constantly resting or plugged in just to maintain minimal function. signaling that its core capacity is significantly diminished. Don't automatically dismiss. While fatigue is common, a sharp increase or profound level of fatigue warrants discussion with a healthcare provider. Rule out treatable causes. The doctor should assess for reversible conditions like anemia, thyroid problems, infections, depression, medication side effects, or poorly managed chronic conditions. Adjust expectations. Recognize that the person's energy envelope has likely shrunk. Help them prioritize activities that are most meaningful or essential. Focus on energy conservation. Encourage rest periods. Offer practical assistance with tasks like cooking, cleaning, or shopping to conserve their limited energy. Shift focus to comfort. Ensure their resting environment is comfortable. Help manage any symptoms like pain or breathlessness that might be contributing to fatigue. Consider care goals. Profound fatigue can signal overall decline, prompting conversations about the level of support needed and potentially about shifting care goals towards comfort and quality of life. Recognizing that a significant increase in fatigue and weakness might be more than just getting old allows families to seek appropriate medical evaluation, adjust care strategies to support comfort and conserve energy, and have important discussions about care priorities, ultimately enhancing quality of life during this phase. Potential sign #2. Marked loss of appetite and unintentional weight loss. The second potential sign is a marked loss of appetite, anorexia, and significant unintentional weight loss. This involves a noticeable and sustained decrease in a person's desire to eat, often accompanied by feeling full very quickly, early satiety, changes in the senses of taste or smell that make food less appealing, or difficulty chewing or swallowing. Even when appealing food is available, the person may show little interest or eat only very small amounts. This often leads to significant unintentional weight loss over a period of months, not because they are dieting, but because their intake is consistently low or their body isn't utilizing nutrients effectively. While weight fluctuations can occur, a loss of 5 to 10% of body weight over 6 to 12 months without trying is generally considered clinically significant and concerning in the elderly. This can be caused by underlying diseases like cancer, heart failure, COPD, medication side effects, depression, dental problems, or it can be part of the natural physiological changes, sometimes termed anorexia of aging or cachexia, severe wasting, that can occur as the body slows down near the end of life. It indicates a potential breakdown in the body's ability to nourish and sustain itself. Mr. Thompson, known for his healthy appetite, gradually starts leaving most of his meals untouched. He says food doesn't taste right anymore and complains of feeling full after just a few bites. Over 6 months, his family notices his clothes are much looser, and he appears visibly thinner, although he hasn't been trying to lose weight. This persistent lack of appetite and resulting weight loss is a significant change requiring attention. It's somewhat like observing a tree whose leaves are yellowing and falling off out of season, and which seems unable to draw sustenance from the soil anymore. It signals a fundamental decline in its vitality and ability to thrive. Seek medical evaluation. Discuss the loss of appetite and weight loss with a doctor to investigate potential underlying causes, including treatable conditions, medication reviews, or dental/swallowing assessments. Focus on quality, not quantity. Offer nutrient-dense, high-calorie foods in small, frequent meals or snacks rather than large meals. Honor food preferences and cravings. Enhance eating experience. Make mealtimes pleasant and social if possible. Ensure food presentation is appealing. Address changes in taste with seasonings if appropriate and medically okay. Do not force feed. Forcing someone to eat when they have no appetite can cause distress, nausea, or aspiration risk. Respect their wishes while ensuring comfort. Prioritize hydration. Encourage sips of fluids frequently, as dehydration can worsen symptoms. Consider nutritional support if appropriate. Discuss options like high-calorie supplements with a healthcare team, weighing benefits against burdens and the person's overall goals of care. Sometimes, a palliative approach focusing on enjoyment of taste over calorie count is more appropriate. Recognizing significant appetite and weight loss prompts necessary medical investigation and allows care strategies to shift. It facilitates a focus on comfort, dignity, honoring preferences, and aligning nutritional approaches with the individual's overall condition and goals, rather than simply battling decreased intake. Potential sign #3. Noticeable social withdrawal and decreased engagement. The third potential indicator is a noticeable pattern of social withdrawal and decreased engagement with the outside world. This refers to a distinct change from the person's typical level of social interaction. They may show significantly less interest in talking with family or friends, decline invitations for visits or social outings they previously enjoyed, spend more time alone in their room, or seem generally more inward-focused, quiet, or emotionally detached. This withdrawal can stem from various factors associated with declining health: profound fatigue, making socializing exhausting; increased pain; hearing or vision loss, making communication difficult; depression or anxiety; cognitive changes affecting social skills; or sometimes it reflects a natural process of disengagement and energy conservation that can occur as individuals approach the end of life. It's important to differentiate this change in behavior from a lifelong introverted personality. The key is a noticeable decline from their previous baseline. Consider Mrs. Lee, always the life of family gatherings and active in her seniors club. Over several months, she starts making excuses to miss club meetings, asks family to keep visits brief, and often seems disengaged or prefers to quietly observe rather than participate in conversations. This represents a significant shift from her established, sociable nature. It can be likened to someone gradually turning down the volume on external input and drawing the curtains in their home. It might signal a need for more quiet, a depletion of social energy, or a turning inward as focus shifts away from the external world. Investigate reversible causes. Discuss the withdrawal with a doctor to rule out or treat conditions like depression, uncontrolled pain, or sensory impairments, hearing aids, glasses adjustments. Respect need for quiet. Don't force social interaction if the person seems genuinely tired or overwhelmed. Sometimes quiet presence is more valuable than forced conversation. Offer gentle encouragement and adapt. Encourage participation in activities they might still enjoy, perhaps in shorter bursts or smaller groups. Adapt communication for sensory loss. Focus on quality of presence. Offer companionship without demanding interaction. Sit quietly together. Hold a hand, read aloud, listen to music. Let them lead the interaction level. Keep lines of communication open. Let them know you are there for them, even if they don't feel like talking much. Inform healthcare team. Significant social withdrawal is an important change to report to doctors or palliative care teams, as it can impact mood and care needs. Recognizing social withdrawal not just as moodiness, but as a potential sign of deeper changes allows caregivers to respond with sensitivity. It prompts investigation into treatable causes while also respecting the individual's potentially changing needs for quiet and energy conservation, offering presence and support appropriately. Navigating these changes requires immense compassion. If you've supported a loved one through this, perhaps share one helpful approach in the comments respectfully. Hit like if you find this awareness helpful. Potential sign #4. Significant changes in sleep patterns, hypersomnia, or insomnia/restlessness. The fourth potential sign involves significant changes in usual sleep patterns. This can manifest in two primary ways. One is hypersomnia, where the individual starts sleeping considerably more than usual, perhaps 15, 18, or even 20+ hours a day, often being difficult to awaken fully even when roused. The other end of the spectrum involves severe insomnia or restlessness, particularly at night, where the person has great difficulty falling asleep or staying asleep, perhaps experiencing agitation, confusion, or repetitive behaviors during nighttime hours, even if they seem very tired during the day. These disruptions to the normal sleep-wake cycle reflect a dysregulation within the body's systems. They can be caused or exacerbated by various factors, including underlying illness progression, uncontrolled pain, anxiety or depression, medication side effects, electrolyte imbalances, reduced daytime activity, or changes in brain function often associated with the dying process. Mr. Davis, who typically slept 7 to 8 hours a night, begins sleeping through most of the morning, taking long afternoon naps, and still feeling sleepy in the evening, totaling perhaps 16 hours of sleep daily. Conversely, Mrs. Green starts experiencing extreme difficulty sleeping at night, pacing her room, appearing agitated and confused despite being clearly fatigued. Both scenarios represent a significant departure from their established sleep norms and indicate an underlying disruption. It's like the body's intricate internal clock and regulatory thermostat are malfunctioning. Either the system gets stuck in an off or low-power mode excessive sleep, or it's unable to find the off switch, leading to agitation and inability to rest properly. Severe insomnia/restlessness. Report changes to healthcare provider. Significant sleep changes warrant medical evaluation to identify and treat potential reversible causes, e.g., pain, infections, medication issues, sleep apnea, restless leg syndrome. Optimize sleep environment. Ensure the bedroom is dark, quiet, cool, and comfortable. Maintain consistent routines as much as possible. Manage excessive sleepiness. While allowing needed rest, ensure basic care continues. Encourage hydration when awake. Assist with repositioning to prevent pressure sores. Provide gentle stimulation during brief awake periods if appropriate. Address insomnia/agitation. Rule out and treat underlying pain or anxiety. Maintain a calm environment, especially at night. Consider non-pharmacological approaches. First, calming music, gentle massage, reassurance. Seek medical advice for possible medication if non-pharmacological methods fail and agitation poses a safety risk or causes significant distress. Focus on comfort. Regardless of the pattern, ensure the person is comfortable and safe during periods of sleep or restlessness. Recognizing significant shifts in sleep patterns as potential indicators of physiological change prompts necessary medical assessment. It allows caregivers and healthcare teams to investigate underlying causes and implement strategies focused on maximizing comfort, ensuring safety, and managing distressing symptoms like agitation, aligning care with the person's overall condition. Potential sign #5. Worsening cognitive function or increased confusion/delirium. The fifth potential sign involves a noticeable worsening of cognitive function or episodes of increased confusion, potentially delirium. This refers to a decline in mental abilities such as memory, attention span, reasoning, orientation to time, place, or person, or language skills that is markedly worse than the individual's previous baseline. If the person has pre-existing dementia, this would be a significant acceleration or worsening beyond the expected gradual progression. Particularly concerning are episodes of delirium, which is an acute state of confusion characterized by a relatively sudden onset hours or days, a fluctuating course better at some times, worse at others, difficulty paying attention, disorganized thinking, and sometimes hallucinations or altered levels of consciousness, either agitated or very lethargic. Delirium in an elderly person is often triggered by an underlying medical issue like an infection, commonly UTI or pneumonia, medication side effects or interactions, dehydration, electrolyte imbalances, recent surgery, severe pain, constipation, or worsening organ function like kidney or liver failure. While gradual cognitive decline can be part of aging or dementia, both significant worsening and especially acute delirium can signal serious underlying physiological stress or changes potentially occurring near the end of life. Imagine Mrs. Patel, who has mild forgetfulness but is usually oriented and conversant. Suddenly, over 2 days, she becomes highly confused, doesn't recognize her daughter, talks about seeing things that aren't there, and is unusually agitated. This sudden change strongly suggests delirium and requires immediate medical investigation to find the trigger, perhaps a UTI. Contrast this with a slow, gradual increase in forgetfulness over years, typical of dementia progression. Delirium is like sudden, severe static completely disrupting a previously clear radio broadcast. It indicates an acute problem with the broadcasting system, the body's health, that needs urgent troubleshooting to identify and fix the source of the interference. Seek prompt medical evaluation for acute confusion. Delirium is a medical emergency. If an elderly person experiences a sudden change in mental status, confusion, or agitation, seek medical help immediately to diagnose and treat the underlying cause. Many causes of delirium are reversible if caught early. For gradual decline, discuss worsening cognitive function with the doctor. Ensure safety measures are in place. Supervision, preventing wandering, managing finances. Use clear, simple communication. Provide frequent reassurance and reorientation. Maintain familiar routines as much as possible. Provide a calm, familiar environment. Reduce excessive noise and stimulation, which can worsen confusion. Use familiar objects and photos. Document changes. Keep track of cognitive changes, including timing and specific symptoms, to report accurately to healthcare providers. Consider palliative care input. Worsening cognition, especially if progressive, may warrant involvement of palliative care to focus on comfort, dignity, and managing distressing symptoms. Recognizing cognitive changes, particularly the acute onset of delirium, is absolutely critical for ensuring timely medical intervention that can potentially reverse the confusion by treating the underlying cause. Understanding gradual decline helps families adapt care strategies effectively to maintain safety, reduce distress, and ensure compassionate support. Potential sign 6. An increased frequency of falls, infections, or hospitalizations. The sixth potential indicator is an increased frequency of falls, infections, or hospitalizations. As the body's overall resilience declines in later life, its ability to withstand stressors, fight off infections, and recover from illness or injury often diminishes significantly. This increased frailty can manifest as a noticeable pattern of recurring health problems. The person might start experiencing more frequent falls, perhaps due to increasing weakness, poor balance, dizziness, or medication side effects. They might develop infections more easily and frequently. Common examples include urinary tract infections, UTIs, pneumonia, or skin infections, and these infections might be more severe or harder to treat. There might also be a pattern of repeated hospital admissions, either for complications of chronic illnesses like heart failure exacerbations or COPD flare-ups, or for acute problems like infections or fall-related injuries. A key aspect is often the difficulty in bouncing back after each event. Recovery takes longer, and the person may not return to their previous baseline level of function. This cluster of recurring health crises often signals that the body's physiological reserves are running low and its overall systems are becoming increasingly fragile. Consider Mr. Simon, 88, who had managed his heart condition well for years. Suddenly, within an 8-month period, He experiences 2 serious falls resulting in minor injuries, is hospitalized twice for pneumonia, and develops a persistent UTI. This pattern of repeated setbacks, where previously he might have recovered quickly, suggests his overall health and resilience are declining significantly. It's akin to an aging historic bridge. For years it withstood traffic and weather, but now minor stresses, a heavy truck and infection, strong winds, a fall cause noticeable damage, hospitalization, injury more frequently, indicating the underlying structure is becoming fundamentally weaker and less able to cope. Treat each acute event, ensure falls, infections, and illnesses receive appropriate medical attention. Recognize the pattern. Crucially, look beyond individual incidents and recognize if there's a trend of increasing frequency or severity. This pattern is often more informative than any single event. Discuss goals of care. This pattern strongly warrants open conversations with the individual, if able, family, and healthcare providers about overall prognosis and goals of care. Is the focus still on aggressive treatments for every problem, or should the focus shift more towards palliative care, symptom management, and maximizing comfort and quality of life, potentially avoiding burdensome hospitalizations if aligned with the person's wishes? Implement preventative measures. Enhance fall prevention strategies at home, remove hazards, use mobility aids, medication review. Promote good hygiene and nutrition to reduce infection risk. Ensure vaccinations, flu, pneumonia are up to date. Consider palliative care consultation. This specialized care focuses on relieving symptoms and improving quality of life for those with serious illness, regardless of prognosis, and can be very helpful in navigating these recurring issues. Recognizing a pattern of increasing health crises is less about predicting the future and more about acknowledging a potential shift in overall health trajectory. This crucial awareness allows for timely and necessary conversations about goals of care, ensuring that medical interventions align with the individual's wishes and focus on maximizing quality of life and comfort during a potentially more fragile phase. Potential sign #7. A marked decline in functional ability/difficulty with activities of daily living ADLs. The 7th potential sign is a marked decline in functional ability, specifically increasing difficulty with basic activities of daily living ADLs. Activities of daily living, or ADLs, refer to the fundamental self-care tasks necessary for basic functioning. These typically include bathing or showering, dressing and grooming oneself, eating, feeding oneself, transferring, moving from bed to chair, chair to toilet, continence, controlling bladder and bowel, and toileting, being able to get to and use the toilet. A significant decline in an elderly person's ability to perform one or more of these basic tasks independently, requiring considerably more help than previously, is often a key indicator of increasing frailty and overall health decline. This functional decline might result from worsening physical conditions like severe arthritis, heart failure, COPD, profound weakness and fatigue, significant cognitive impairment like advanced dementia, or a combination of factors. It signifies a loss of capacity to manage the most fundamental aspects of personal care and often necessitates an increase in caregiving support. Mrs. Green, 90, who lived semi-independently with some help for housekeeping, starts needing significant assistance from her daughter just to get dressed in the morning, is often too weak to bathe herself safely even with grab bars, and requires help transferring from her bed to her walker. This marked increase in her need for help with these very basic ADLs, compared to just 6 months prior, signals a significant downturn in her functional status. It's like observing someone who used to be able to perform all the essential functions to operate their own vehicle, getting in, starting it, steering, braking, now struggling significantly with each of those basic steps. It indicates a fundamental loss of operational capacity. Assess needs accurately. Honestly evaluate the level and type of assistance now required for each ADL. Identify specific challenges. Ensure adequate support. Arrange for the necessary help, whether from family caregivers, professional home health aides, or transitioning to a higher level of care facility if needed and desired. Ensure caregiver support to prevent burnout. Prioritize dignity and comfort. Approach assistance with ADLs respectfully, preserving the person's dignity as much as possible. Focus on comfort and safety during care tasks. Utilize adaptive equipment. Employ tools that can help maintain partial independence or make care easier, e.g. shower chairs, raised toilet seats, adaptive utensils, dressing aids. Discuss with healthcare team. Report significant functional decline to doctors or therapists. It helps inform prognosis, care planning, and eligibility for certain services like home care or hospice. Revisit care plans. A marked decline in ADL function often necessitates a reassessment of the current care plan and potentially difficult decisions about future care arrangements and goals. Recognizing a significant decline in the ability to perform basic activities of daily living is a crucial marker of increasing frailty and dependency. It highlights the need for adjusted care strategies, increased support, and prompts essential conversations about ensuring safety, comfort, dignity, and appropriate care levels during this advanced stage of life. We have gently walked through 7 potential signs that healthcare professionals often observe in elderly individuals who may be entering a period of significant health decline, sometimes within their final year or so. Profound fatigue and weakness, marked appetite and weight loss, social withdrawal, significant sleep pattern changes, worsening cognitive function, increased frequency of health crises like falls or infections, and a marked decline in the ability to perform basic daily activities. It is absolutely essential to reiterate that recognizing these signs is not about predicting death or giving up hope. It is about fostering a deeper, more compassionate awareness of the potential changes that can occur in advanced age or serious illness. This awareness is powerful. It allows families, caregivers, and healthcare teams to respond with greater sensitivity and effectiveness. It encourages us to ask the right questions, to seek appropriate medical evaluations to rule out treatable conditions, and, crucially, to initiate open and honest conversations about what truly matters most to the individual regarding their care and quality of life in the time they have left. The focus shifts from solely fighting decline to holistically supporting the person with dignity, comfort, and respect for their wishes. Ultimately, this knowledge empowers us. It empowers us to provide better, more attuned care. It empowers us to advocate for our loved ones' needs and preferences. And it empowers us to cherish the time remaining, focusing on connection, comfort, and ensuring that the final chapter of a long life is lived with as much peace and dignity as possible. Please remember, always rely on professional medical guidance for diagnosis and care planning, not solely on these general observations. This is undeniably a difficult subject to contemplate. Perhaps you could share, respectfully, in the comments below one insight gained today, or one way this heightened awareness might influence how you approach supporting an elderly loved one. Sharing helps us all learn and support each other. Thank you for approaching this sensitive topic with me today. Your willingness to learn and understand is a testament to your care. If you found this information helpful, even if difficult, please consider giving it a like. It helps others find this resource. Please feel free to share this video thoughtfully with others who may be caring for elderly loved ones or navigating these stages themselves. And if you haven't already, please subscribe to the channel and click the notification bell for more content focused on health, wellness, and navigating life's challenges with knowledge and compassion. Leave a comment with your reflections, done with respect for the sensitivity of the topic. Thank you again for watching. Wishing you and your loved ones strength, comfort, and compassionate support on life's journey. I look forward to seeing you in the next video.